Preconception screening really refers to testing an individual before a pregnancy, in other words, preconception, in contrast to prenatal testing, which is testing that can be done, but that's after a pregnancy has already occurred. So in terms of preconception type screening, it can apply to evaluating ovarian reserve or egg supply in the female. It can apply to checking a semen analysis. And the reason that's important is that for those that are either immediately interested in getting pregnant or those that are looking to the future, they want to know what problems may lie ahead. So if one determines that they have a poor egg supply or poor ovarian reserve, it certainly allows them to make some decisions and move towards pregnancy sooner. Or in a lot of cases, women today will freeze their eggs, whether it's through a program like egg banks or others. There's a valid way of stopping the biological clock. So that's important relative to preconception screening or planning. Another area that's very important is preconception genetic screening. And what we're talking about here is looking for mutations that can occur in any one of us. And a mutation by definition means that inside a given chromosome, there are hundreds of genes, and if there are mistakes that occur within those genes, that's how we define a mutation. If a man and a woman each have the same mutation, then they can pass that on to their children. And so most of us have heard of cystic fibrosis, thalassemia. There's others such as Tay-Sachs, SMA, spinal muscular atrophy. These are terrible genetic diseases that are completely preventable if you can determine ahead of time that a couple's at risk. So within the last 5 years, there are several companies that offer testing. Counsel is one that is very popular, Good Start Genetics another one, and we use both of them. And it allows you to look at hundreds of different potential mutations in a relatively inexpensive manner. And obviously, if a given individual is noted to have certain mutations, then you check the partner. The only thing that matters is that you don't want them both to have the same exact mutation, because then their children are at risk, about 25% risk, to have serious genetic problems.